So when I have patients come in and they have diabetes, we talk about ways to keep them from getting into trouble. And we talk about how increased blood sugar can lead to bad things, and those bad things can lead to nerve problems, tingling, burning, numbness. When your feet go numb, then a lot of bad things can happen. You can get sores in your feet, those sores in your feet that you don't feel and you're walking on for long periods of time. They can get infected, and the infection can lead to an amputation and so on. Lots of bad things, but it all really comes back to the basics of high blood sugar. And for patients to kind of understand the process, we talk about it really like this. Number one, if you have excess blood sugar in your system, that can convert to a type of alcohol called sorbitol. And sorbitol has been, it's been addressed in many different studies as far as linking that type of alcohol to nerve disorders. And what the sorbitol does is it attacks your nerves. And your nerve is really no different than an electrical wire that you plug into an outlet. So think about, I don't know, plugging in your microwave to the outlet in the kitchen. If you look at that plug, you're going to see the cord that really is a wire covered with an insulation, which is usually plastic, and then you plug that into the wall. Your nerve is no different. Your nerve really is a wire, and around that wire is insulation, and that's called myelin. And that's the myelin sheath is really important for two reasons. Number one, it protects your nerve, but number two, it helps to speed up the transmission of wherever you're getting those sensations to your brain. And so sorbitol, which is, again, excess sugar in your system that converts to sorbitol. Sorbitol attacks those nerves, and basically, for a lack of better term, it leaves rat bites in the cord. So what you have is this wire that gets exposed as the sorbitol attacks the nerve, and then your body has a hard time interpreting the sensations because that clean channel of that sheath that's protecting the nerve and sending those signals to the brain has now been disrupted, and you've got an exposed nerve or an exposed wire. So the sensation gets to that area and kind of doesn't know how to handle it, and your brain doesn't know how to interpret it, and eventually it makes it up to the brain as tingling, burning, and numbness. And if you get enough of that, think of kind of like a TV we used to have in the 70s and 80s with the rabbit antenna. We used to move the rabbit antenna to get the signal. Well, what if that rabbit antenna didn't get the signal good enough, and you really didn't want to watch that channel anymore? You just changed the channel. And we didn't have remotes back then. We actually got up and changed the channel. Well, think of your brain doing that. So it's tired of getting these sensations it can't really understand, and it just says, I'm done with that. I'm going to change the channel. And then your foot or your feet go completely numb, and that's when really bad things happen. But it starts with high blood sugar. And I don't think a lot of people with diabetes realize the connection there. They know that if I have diabetes, that can lead to kidney disease, heart disease, eye disease. It can cause neuropathy. They know all that stuff, but they don't really know how one thing correlates to the other, how one thing leads to another. And I think that's a really good example of how having high blood sugar in your system can lead to neuropathy, can lead to numbness, can lead to ulcers, can ultimately lead to infections and amputations. So really keeping your blood sugar at good levels, trying to avoid these spikes in your blood sugar for long periods of time. I have patients that have had crazy high blood sugars for years before they even realize they have diabetes. And all that time, that sugar's been converting to the sorbitol and attacking the nerves. And sometimes by the time they get diagnosed, they're already in neuropathy land. So I tell all my patients, really manage your blood sugar, not because you think, oh, someday I'm going to have this problem, because hopefully now, after I've explained it to them, they can see the relationship between having that high blood sugar and how it trickles down into all these other issues. And I'm sure there are similar stories to all the other diseases and problems that high blood sugar causes. But for me, as a podiatrist, as a foot doctor, that's the biggest correlation: is the high blood sugar to peripheral neuropathy that leads to ulcers and amputation. So we have that talk quite a bit, and hopefully they walk away with a better understanding of why high blood sugars can cause such a problem.